We're going to get right to the latest on where things stand with the coronavirus. The Senate now passed that new $484 billion relief package that will support small businesses, hospitals, and more coronavirus testing. Meantime, during talks at the White House, President Trump and Governor Andrew Cuomo of New York agreed to increase testing in hard-hit New York State, with both men calling their conversation productive. Also overnight, officials in California announced the earliest known coronavirus death in the U.S., an autopsy revealing a person who died on February the 6th was infected. That's nearly 3 weeks before what was believed to be the nation's first fatality. Savannah?
So where things stand this morning, Hoda, cases of the virus have now topped 809,000. More than 44,000 people in this country have died. We've got complete coverage for you. Let's start with NBC's Blaine Alexander on this battle over when and how to reopen states. Blaine, good morning to you.
Well, Savannah, good morning. Many of these businesses have not opened their doors in weeks, but much of that will change in the next 48 hours. But with COVID-19 cases on the rise here in Georgia and around the country, there's new concern about taking the foot off the brake too soon. As some states get back to business, it's anything but usual. Tennessee and South Carolina loosening restrictions, but the most aggressive rollout is in neighboring Georgia. Starting Friday, all hair salons, barbershops, tattoo parlors, even bowling alleys are cleared to reopen. The governor says safety measures must remain in place, including 6-foot social distancing and wearing masks.
I would tell you that I imagine there'll be people in gyms that'll be a lot safer than they would be going to the grocery store.
But critics say the nature of those businesses makes social distancing practically impossible.
There's nothing essential about going to a bowling alley in the middle of a pandemic.
I believe people in Atlanta would understand that if their cases are not going down, that they need to continue to do everything that we said: social distancing, washing your hands, wearing a mask in public. So if there's a way that people can social distance and do those things, then they can do those things. I don't know how, but people are very creative.
In Albany, Georgia, the small town leads the state in COVID-19 deaths. Is your city ready to reopen?
We are not ready to reopen. We are not out of the woods, and it is irresponsible for the governor to take these measures.
And from fellow Republican and South Carolina Senator Lindsey Graham,
I worry about that Georgia is going too far too quick, and it could affect us here at home.
In Southern California, Sunseekers now have access to parks and golf courses, both back open with modifications. As some states are scaling back restrictions, others only tightening the reins. In Alabama, these protests did little to convince Governor Kay Ivey to lift the state's stay-at-home order.
We have to be careful and cautious in what we are doing.
More protests in North Carolina, a push to not extend the shelter-in-place order set to expire next week. Back in Georgia, some business owners say, order or not, they're staying closed.
I personally think it's incredibly irresponsible to be opening at this point.
Others trying to find ways to serve their customers safely.
For the people who want to get back to day-to-day life, that's why we're here.
And Hoda, one of the biggest questions about the governor's actions here in Georgia is why choose to reopen businesses with such close contact, like hair and nail salons? Well, the governor says that unlike most businesses, these are ones that cannot operate from home, so they've been closed completely for weeks. And without any income, he says, they risked losing everything. Hoda.
All right, Blaine, thank you. All right, we're going to go now to the federal response, and we're going to go to Kristen Welker, who has more on what the Senate is doing with that new bill that was just passed, the $400+ billion bill. Hey, Kristen, good morning.
Hey, Hoda, good morning to you. Washington is now one step closer to helping millions of small businesses in need. And the Trump administration is making it clear larger businesses and universities need not apply. It comes after a bipartisan backlash after some of those initial funds got into the hands of some of the wealthiest.
This morning, new relief is in sight for Americans hit hard by the coronavirus outbreak.
The bill as amended is passed.
The Senate passing a nearly $500 billion aid package. The main focus, funding for small businesses crippled by the nationwide shutdown. It also includes $75 billion for hospitals and another $25 billion for coronavirus testing. President Trump signaling he'll sign the bill when it reaches his desk as early as tomorrow.
I urge the House to pass the bill, and they're going to be voting on it, I imagine, very soon.
The Paycheck Protection Program is designed to help small businesses with fewer than 500 people, but a number of larger companies were able to receive some of the program's initial funds before it ran out last week. Now the Treasury Secretary says large firms will be blocked from the program.
Certain people on the PPP may have not been clear in understanding the certification. So we will give people the benefit of the doubt.
One of those bigger businesses, fast food chain Shake Shack, vowing to return the money. Now, President Trump singling out Harvard University, saying they should follow suit and pay back $8.6 million in relief money.
Harvard's going to pay back the money. They shouldn't be taking it. When I saw Harvard, they have one of the largest endowments anywhere in the country, maybe in the world, I guess. And they're going to pay back that money.
Harvard says the money was received as a part of a different stimulus plan and would be used for helping its students who need financial assistance. A spokesperson releasing a statement reading in part, Harvard did not apply for, nor has it received any funds through the U.S. Small Business Administration's Paycheck Protection Program for small businesses. Reports saying otherwise are inaccurate. Still, banks are dealing with a backlog of applicants, including Crystal Nezgoda, who owns a California coffee house.
I bought this business a year ago, and we were just starting to make a profit.
Nezgoda applied for a small business loan, but says she never heard back.
We're just stuck. It's very disheartening.
NBC News confirmed overnight that the Small Business Administration has alerted nearly 8,000 small businesses who applied for loans that their information may have been leaked due to a bug in the system. The SBA saying they will provide free credit monitoring for a year for those impacted. Meanwhile, as for that relief bill, the House is expected to vote on it tomorrow, and then it heads to the president's desk. Savannah?
All right, Kristen, thank you. And now to more on the public health crisis, that new warning from the head of the CDC that the coronavirus could hit the U.S. even harder later this year. NBC's Tom Costello's in Maryland this morning with that part of the story. Hey, Tom, good morning.
Yeah, good morning, Savannah. You know, we have seen parts of the country where they're starting to see success with the coronavirus. Other areas of the country, including what they call the DMV, the District of Columbia, Maryland, and Virginia, we have not seen a significant decline. We've not seen a significant flattening of the curve. And nationwide, there's now talk that next fall, next winter, the next wave of this could be even worse. This morning, a new warning from the director of the CDC, saying in an interview with the Washington Post that there's a possibility next winter will actually be even more difficult than the one we just went through, citing concerns about the next wave of coronavirus being coupled with the seasonal flu. Dr. Birx asked about those comments during yesterday's task force briefing.
We're also hoping by that time that we have additional treatment options for people with COVID-19. I don't know if it will be worse. I think this has been pretty bad. When you see what has happened in New York, that was very bad.
It comes as the timeline for the disease is changing here in the U.S. Officials in Santa Clara County, California now say 2 residents there died of coronavirus in early and mid-February, weeks before the United States' first coronavirus-related death was reported. Those officials pointing out that the residents did not have any known travel history that would have exposed them to the virus and are presumed to have contracted it in the community. Meantime, as the FDA conducts treatment trials, a panel of doctors with the NIH is issuing a new warning about a drug touted repeatedly by President Trump, hydroxychloroquine.
What do you have to lose? They've been taking it for 40 years for malaria.
It comes as a small analysis among VA hospitals found a higher mortality rate among patients given hydroxychloroquine, as well as those who received the drug in combination with the antibiotic known as Z-Pak. Researchers involved say they did not find the drug to be effective, adding their analysis highlights the importance of waiting for ongoing controlled studies before widespread adoption of these drugs. And on the testing front, new details on an at-home nose swab kit from LabCorp. To qualify, you have to fill out a questionnaire on the company's website before a kit is overnighted to your home. That sample is sent to a lab with results in 1 to 2 days. For now, that test is focused on the healthcare workers and first responders.
I would expect over the next several weeks that it'll become more and more available to the general public, particularly those that have symptoms.
You know, a lot of focus right now, a lot of focus on reopening parts of the economy. The Justice Department says it's paying close attention. The Attorney General says some of these stay-at-home orders actually border on home arrest, which he says borders on whether it's constitutional or not. But he also says it would be justifiable in some cases, but not for the long term. The Attorney General watching all of this closely as well. Savannah and Hoda, back to you.
All right, Tom, thank you. And joining us now is NBC News science contributor Dr. Joseph Fair. He's a virologist and epidemiologist. He was on the front lines of the Ebola outbreak. Dr. Fair, good morning. I want to ask you about the CDC director's new warning that potentially in the fall and winter, the coronavirus crisis could be even worse because it would then be combined with the flu season as well. What do you make of this?
It's really all about timing. So, you know, we know in the fall season, that's typically when we have our worst of flu seasons. And flu seasons can vary year by year. But typically, I think in the last year, we saw approximately 34,000 deaths due to influenza in the United States alone. So if you couple that with an ongoing outbreak of COVID-19 in people that have not had COVID-19 that are still naive to it, which by, you know, that time frame will still have a significant part of our population that will be naive to the virus. So if you couple those two things together, it's going to make kind of for the perfect storm of infectious disease and overloading of hospital wards. The good news on this, though, is hopefully by that time we'll have enough testing in place. You saw just now about the first in-home test being made available. I expect we'll have much more of those tests available by that time. And that will give us time at least to catch up on things like ventilators and PPE production.
Well, and Dr. Birx said that hopefully at that time we also would have something in the way of treatment, not a vaccine, but a way to treat the coronavirus, which theoretically, I guess, means fewer deaths, better outcomes, less of a catastrophe.
Yeah, absolutely. And I think we have two very promising, you know, kind of avenues to go forth with on treatment right now. And that's just right now. I'm sure there'll be even more so in the next few months. But the first and foremost is the convalescent plasma. We've talked about that even on this show, which is, you know, you've recovered from coronavirus and you've now developed protective antibodies against that coronavirus. We can take your blood, separate the plasma from it, and literally just transfer that into a person that's currently infected with COVID-19, and that will improve their outcome typically. And it's a very tried and true hundreds-of-year-old treatment. And then, of course, the drug from Gilead Pharmaceuticals, remdesivir, has shown promise now in a couple of clinical trials, and I think we'll only see more of that.
What's the implication of an at-home test? They're starting to roll it out today. Is that something that could be scaled up and really make a difference here?
I'm biased. My background is in diagnostics, but outbreaks really, to me, begin and end with diagnostics. It's when we have diagnostics available everywhere, very easily, very cheap, and as rapid as possible. That's how we're actually going to stop this outbreak, combined with, of course, the social distancing measures and ultimately a vaccine. But having that diagnostic out there, both for the acute infection as well as have you recovered from the infection, are going to be key for us to move forward.
And real quickly, there's this item that in Santa Clara County in California that there was a coronavirus in early February, which is weeks before the first previously known death related to coronavirus. What is the implication of that? Is it that there could have been community spread far before we thought?
Absolutely. And, you know, I have to say, first of all, that's not uncommon for any outbreak we'll go to. We'll always end up once we kind of slow down from the initial response, we'll always end up looking for what was the index case. So you always know the first one that was reported, but that's just the one that made your, you know, radar screen. We always go back and look for the ones that did not make our radar screen. And ultimately, we try to find our way back to an index case. So, you know, that's telling us that this virus was in this country and community spread was ongoing much earlier than what we officially thought it was, and that, you know, we even had people dying from it at that time, not just in the country, but people were dying from it at that time. And I'm sure we'll find even earlier dates with that, and the same will be true for China.
Wow. Okay. Dr. Fair, always good to get your perspective.
Likewise.
Thank you very much. Hoda will send it to you.
All right. We do have a lot more to get to, Savannah, including new uncertainty surrounding the health of North Korean leader Kim Jong Un, who hasn't made a public appearance in nearly 2 weeks. NBC's chief foreign correspondent Richard Engels following that story for us. Hey, Richard, good morning.
Good morning, Hoda. It is a mystery, and so far, mum's the word from North Korea. There have been no official statements from North Korean authorities about his whereabouts or his health, and that's just fueling speculation about his condition.
It's been a week since Kim Jong-un missed his late grandfather's commemoration, and this morning, he remains out of sight. Several U.S. officials tell NBC News American intelligence reporting indicates Kim, overweight, often seen smoking, recently had cardiovascular surgery, with some officials saying the intelligence suggests he's incapacitated. President Trump, who's met repeatedly with Kim, spoke out yesterday.
These are reports that came out, and we don't know. I wish him well.
But South Korean officials say Kim is as active as ever, working. They say they have no intelligence to support claims of his failing health. But members of parliament there are now demanding more information. And South Korean media is full of speculation about who might take over, since Kim has no clear successor. Often mentioned is his younger sister, Kim Yo-jong, the most powerful woman in North Korea and an increasingly visible advisor. Kim Yo-jong made her public debut representing Pyongyang at the 2018 Olympics, billed as a peace games between North and South Korea, impressing her hosts with her easy grace and charm. She's also under U.S. sanctions in response to the regime's human rights abuses. Kim Jong-un's older half-brother and former rival is no longer a contender. He was assassinated in 2017 at Malaysia's main airport when a woman sneaked up behind him and smeared a chemical weapon in his face. Before his death, shortly thereafter, he'd often spoken out against Kim Jong-un, calling him a dictator.
A power vacuum in North Korea, or worse, a power struggle, would also call into question the country's ability to control its nuclear weapons. Savannah, back to you.
Let's get our first check of the weather, and for that we say good morning to Mr. Roker. How you doing, Al?
Hey, Al.
Well, I'm doing fine, guys, but unfortunately our friends down to the south and in the plains are going to be suffering today with severe weather. You can see we've already got flood watches up for parts of Oklahoma and on into Alabama, and we've got a severe storm risk for today for 26 million people. Hail, tornadoes, wind gusts, and in fact, we have an enhanced risk right now for tornadoes and hail stretching from Oklahoma into Texas all the way into Arkansas and Louisiana. And tomorrow it moves to the east. 29 million people at risk for tornadoes, wind gusts, and hail 1 inch or larger. We watch this strong storm system tracking into the lower Mississippi River Valley. The severe threat ramps up this afternoon. By tomorrow it moves east with a heavy rain threat and a risk of flooding. It continues on into Friday with heavy rain moving into the northeast and heavy thunderstorms across northern Florida. We're talking rainfall amounts of 2 to 3 inches generally, but locally 4 to 6 inches in the lower Mississippi River Valley.